I'm Dr. Angelo Giardino. I'm the Chief Medical Officer at Texas Children's Health Plan, and we're here today to talk about a really serious issue, child abuse and neglect. So if you look nationally, there's approximately 700,000 children who are confirmed to be victims of child abuse and neglect. Most of those 700,000 confirmed cases are for child neglect, where a basic need is not being met. And that's probably about 75% of the cases. 15% of the cases are for physical abuse and neglect. That's where a child essentially gets injured by one of their caregivers. And then approximately 10% are for sexual abuse. If you look at the more local numbers, and if you look at the Harris County service area and the Jefferson County service area, there's about 38,000 children who have investigations for child abuse and neglect, and about 8,000 children in Harris and Jefferson counties end up being confirmed as child abuse and neglect victims. Child abuse and neglect presents in a number of different ways, and in the healthcare setting, we always start with the healthcare evaluation. So a physician or nurse practitioner always does a history. So as we ask the family questions, we might identify concerning responses to our questions. Part of the healthcare evaluation is doing a physical examination, and our training allows us to look at findings on the physical examination and then consider those, and those might raise the concern of child abuse and neglect as well. Child abuse and neglect is both a medical problem and a criminal justice problem. So if in the context of doing a healthcare evaluation, one is concerned that a child might be a victim of child abuse and neglect, clearly the first thing we do is we make sure that the medical issues are covered. But alongside of covering those medical or healthcare issues, there is a mandated reporting responsibilities to the appropriate authorities. And that report can be made either by phone, and the number's on your screen, or there is a website that one can make an online referral as well. We have a number of programs that are actually child abuse and neglect prevention programs. So we have two, the Nurse Friendly Partnership and Healthy Families America. Those two programs are home visiting programs, and those have been shown through rigorous peer review evaluation that's been published to support families in learning how best to care for their children and actually preventing child abuse and neglect. And finally, we support a number of community organizations that raise awareness around child abuse and neglect. Reading journal articles and book chapters is a great way to keep up with the current state of the art in terms of what the knowledge is around those questions that might raise concerns or physical findings that might raise the specter of child abuse and neglect. In addition, I would really encourage our providers to get involved with the number of community organizations that are out there that are really working on raising awareness around child abuse and neglect, promoting positive parenting, and essentially making it clear to our community partners what the signs and symptoms are, so that anyone who comes in contact with the child can raise that concern and hopefully intervene. So this is Angelo Giardino, the Chief Medical Officer of Texas Children's Health Plan, thanking you for giving us your time. And I would really encourage you to reflect upon child abuse and neglect and think about how you in your practice are screening for child abuse and neglect, what you do if you identify, and how you're connected to the community in terms of making those reports and encouraging home visiting so that we can prevent and eventually eliminate this problem from our community.